The following segment is sponsored by Intermountain Healthcare. February is Prenatal Infection Prevention Month. Taylor Hanton is a neonatal nurse practitioner with Intermountain Healthcare, and she's here to share tips that will help keep our babies safe. Welcome. Thank you so much for being here.
Thank you.
Absolutely. We're so excited to have you, and this is such an important topic. It is. So what is the most important common cause of newborn infection? Can you tell us for people who aren't aware?
Sure. So Group B Strep is the most common infection in newborns, and our incidence in the state of Utah is higher than the national average. And so we want to do whatever we can to help identify those babies that may be at risk for developing GBS infection at birth.
Okay, and how is it possible that people are potentially passing this on to their newborn?
So normally Group B Strep lives in the genital area, so mostly in the vagina and rectum. And so since babies are in that area during the birthing process, we need to identify whether or not moms who are pregnant have this infection, have this bacteria in that area, so we can make sure that we're treating those babies appropriately.
And do mothers sometimes show these symptoms of the Group B Strep, or how would they know that they could be potentially passing it on to their baby?
So Group B Strep is just a normal bacteria that lives in this area, so moms are generally asymptomatic. It's not the same group, it's not the same strep that causes strep throat. It's a very different type of infection. So it's just that these bacteria live in these areas. So moms don't know that they're positive or have this bacteria in their genital tracts. But the way that we screen for them is just during their normal routine prenatal care, their provider will swab those areas just to see if that bacteria is present.
Okay, that's really important information because, like you said, people are typically asymptomatic, so they wouldn't know. So you do want to have that test or have those tests conducted. Is the rate among children higher or lower nationally here in Utah?
So in Utah, we are a little bit higher for GBS infection in newborns compared to the national average. So we're trying to do a little bit more education and telling moms the importance of getting good prenatal care and getting their GBS status known. It's not an infection in moms per se. It's just that these bacteria can live in these areas, and it's they're not symptomatic, and it doesn't mean anything if you are positive or negative other than just delivering a baby.
Okay. Are there tips for ways to prevent having this infection, or you said it's not an infection, but having these rates? Like, how do people prevent that?
So it's there's really nothing that they can do whether or not they have it. What we do during labor is if a mom is GBS positive, we'll treat her with IV antibiotics to help decrease the incidence of exposure to the unborn baby. So it's just how we treat moms and how we monitor the babies, because GBS, even though it doesn't cause serious complications or even symptoms in adults, in newborn babies it can cause blood infections, it can cause lung infections, it can cause meningitis, which is an inflammation or infection in the fluid that surrounds the brain and spinal fluid. So it can be devastating for a baby, so that's why we want to make sure that we identify those babies at highest risk, treat moms appropriately so we can keep mom and baby together safely.
Absolutely. What you guys are doing is so important in, increasing that awareness, and of course, ultimately keeping these babies safe and healthy. That is the ultimate goal. We can go to the website on our screen for more information, correct?
Yes. Okay. Yep. Intermountainhealth.org.
Perfect. Thank you so much for coming. We so appreciate it.
Thank you.